Good day, guys. My name is David, and today we're going to be talking about urinary output, normal urinary output in the human body, collection of urine specimen in patients who can ambulate, which is collection of urine normally, and then collection of urine in patients who cannot ambulate using bedpans and urinals. What is urinary output? Urinary output can be defined as a measure of total amount of urine excreted from the human body over a period of time. Urinary output is usually taken over a time span of 24 hours, and the normal urinary output for humans is 1,500 milliliters per 24 hours or per day, which is also 1.5 quarts. Why should urine be collected? Urine should be collected so that an analysis of urine can be done, which is called a urinalysis. Using a urinalysis, various diagnoses can be made, as well as various deductions can be made in coming to a conclusion on disorders or ailments affecting the urinary tract. When should urine sample be collected? Urine sample should be collected upon the instruction of a doctor. Thank you. Now we're going to look at the materials we're supposed to use. The first material we have is the disposable gloves. The second material we have is the bed protector. Bed protector is used for patients who cannot ambulate. The third material we have is the bed cover, also used for patients who cannot ambulate. Fourthly, we have the small plastic bag. And then we have the bedpan or the urinal for patients who cannot ambulate. Then here we have the specimen container for patients who can ambulate. This is going to be used in the toilets for patients who can ambulate. And then we have the biohazard specimen transport bag. Here we have the specimen container in which this specimen container is sent to the laboratory for examination. Then we have the graduated pitcher. And then finally, we have the laboratory requisition form. Thank you. Is to perform good hand washing measures and then apply your gloves. In this case, we have a patient which cannot ambulate. Therefore, we provide the patient with a protective bed cover to prevent soiling of the bed. We also provide the patient with a bed cover to cover themselves in the process. And then we provide the patient with a bedpan or a urinal in which the patient urinates into. We then go on to help the patient by cleaning after them with a toilet tissue. After doing this, we then dispose this toilet tissue into the small plastic bag for used supplies. We then take the bedpan and its contents and we pour the contents into the graduated pitcher. And then after we've done this, we take the specimen container and we open it, and then we pour 150 milliliters from the graduated pitcher. After this, we cover the specimen container and place it into the biohazardous specimen transport bag, and then we pour the remaining contents of the bedpan into the toilet. Now once we're done with this, we then proceed to take the specimen container and its contents to the laboratory for examination. Thank you. In this case, we're dealing with a patient which can ambulate, so we give the patient a collecting container which the patient takes to the bathroom and voids inside. After this, we collect this container and we pour the contents into a graduating pitcher. After this, we take our specimen container and we then pour 150 milliliters into the specimen container. After this, we close the specimen container and then place it into the biohazardous specimen transport bag. We then pour the contents of the collecting container into the toilet and then we discard our gloves.